All right, well, let's go ahead and get started. First off, thank you all for joining our 10th and final COVID-19 think tank. I think I speak for everybody when we had no idea that starting this back up, I think in March, that we were going to have 10 of these, especially with the amount of attendance we've had and the amount of discussions and the great projects that have been shown. So thank you all for participating today and for participating in any of the think tanks going forward. As usual, this is presented by the Society for Health Systems, where our mission is to improve lives through better healthcare delivery. We do that in a multitude of ways, cultivating a community such as we're doing with these think tanks of healthcare improvement professionals who are just passionate and trying to make a difference within healthcare. We have a multitude of communities of practices, I can't get it right, that are focused around bringing like-minded individuals together to do that collaboration and making healthcare a better space. So if you see any of these that you would be more interested in, or you're interested in joining IISE, please reach out to Erin or myself, or join at the link below. As I said, there are 10 of these now, with this one being our last installment. So if we mention anything today that we've talked about in previous think tank recordings, or you just want to go back and listen to the ones you've missed, we have all the recordings saved here, and I just found out we'll be posting them on the IISE website as well. So you can go back and learn about all the great topics that we've covered so far. Also, as this is the last think tank, if you are still looking for resources, please go to IISE Connect. That's where all these think tanks will be posted, as well as a multitude of resources that have either come out of this think tank or other IIEs have posted there throughout the month. So there's the link for you, all easy peasy. So today we have very exciting people joining us who are also big Society for Health Systems members. So we're looking forward to the projects that they've done during this COVID, and also a semi-wrap-up session of learning and opportunities ahead. So with that, I'm going to pass it off to Amanda and Tarun, and looking forward to this conversation.
Thanks, Allie. This is Amanda. My role is at Navicent Health, which is located in Macon, Georgia. It's about an hour and a half south of Atlanta. And my role is Vice President of Facility Planning and Development. Tarun?
Good afternoon, everyone. Tarun Mohanlal. I work as the Chief Analytics Officer at Navicent Health. Amanda has been my mentor for years now, and I've gotten to know her through Society for Health Systems, and now we are colleagues at the same organization. So I'm thrilled to be doing this webinar along with her today. Thank you.
Thanks, Tarun. So today what we wanted to talk with you about is some of the changes that we've seen from COVID-19. And we're going to categorize things into 3 sections. There's learning, opportunities, and the look ahead. And we don't have many slides. It's more formatted as a discussion from an industrial engineer's perspective and being involved with the COVID-19 pandemic. Both Tarun and I have had the opportunity of serving on our organization's incident command structure, and Tarun has served many rotations as our planning chief, and I usually serve as our operations chief. We're actually back on command starting today, so a lot of our experiences that we're going to share are from that involvement with our health system, and will be mostly focused kind of a view from our experiences there. So to get started in the learning bucket, what have we learned from all of this? I would say the first thing that I could think of was the value of systems thinking. And all of us know the value of systems thinking in our day-to-day operations, and it was unbelievably magnified in response to the pandemic. Specifically, optimizing for public health versus optimizing for a single health system or hospital. And this became really evident in our particular community as a health system about 2 hours away from us had 2 super spreader events that led to their local hospital being completely packed and maxed out with a critical outbreak of COVID-19. It was on the national news and really challenging there. So we had to balance supporting that health system while protecting our own local community and being ready for our own surge in our community. So there was the bigger picture, but then there was also optimizing for our entire health system versus any single department or hospital. So we had limited resources, things like ventilators or protective personal equipment that was in maybe short supply. And we had to make sure that it's being allocated appropriately across our health system and not just optimized for one particular hospital or department. Tarun?
So yeah, being new to the command center construct, as I was assigned as the planning chief and given the background Amanda gave, I was amazed with the number of industrial engineering tools and techniques that came to be handy in the planning efforts. I'll specifically pick a few. As Amanda mentioned, we were in this flux of knowing that a few health systems in the surrounding neighborhood were impacted significantly. So we had to really be cognizant of that. And although there were several public health models available out there, we had to really do some extensive modeling to understand what the spread in our community looks like and what's that surge that we need to plan and be prepared for. We did extensive modeling. We applied multiple epidemiological models and forecasting models and methods to be able to understand our surge capacity needs. In addition to that, project management really became very critical as we had to bring multiple stakeholders to understand, given our multi-hospital system, how are we really going to plan and coordinate this surge if it ever occurs, and how are we going to manage our bed capacity, our PPE needs, and then also our staffing needs. There was extensive effort that we had to put in place even when it came to protecting our own employees, talking about temperature checks at the entrances. We needed to be cognizant of applying some of those queuing methodologies that we've all familiarized ourselves with to make sure there's not extensive queuing at these entrances, because that's, again, one of the goals we want to reduce the spread. The other example that Amanda kind of alluded to was on the front of supply chain management. How can we plan and prepare for the inventory that we have, while at the same time, safety of our employees is important. We also wanted to make sure we are not hoarding more than we needed from a supplies standpoint. So certainly it was amazing how we were able to quickly apply a lot of these industrial engineering and tools as we planned and prepared for being ready to really work towards keeping our employees safe and also taking care of our patients.
Another aspect that we learned about and found was really important was being flexible and just willing to step outside of our role or title and do whatever is needed at the time. Of course, we always try to be flexible and willing to contribute. However, it was absolutely critical. Normally in a day-to-day operation, I would be focusing on facility support services or on some strategic initiatives and planning. However, in the pandemic, I had to shift focus to initially serve as our logistics chief, and then I moved over into the operations chief role in our incident command. And that really required stepping outside of my normal chain of command and structure and focusing on things that are well outside of my swim lane or area of responsibility. So some examples of that were initially when the testing first came out, guidance was issued from various sources, and all of that guidance was in written format. And it would be like a multi-page document, say like 5 pages, that basically was a decision tree, a clinical decision tree for when to do testing. And it was very hard to interpret and really not usable in that format. So one of the things that that I did early on was interpreting those guidelines and putting them into a decision tree or flowchart format so that it would be easy for our clinicians to follow through and follow those guidelines. Another example was on incident command, we have to take a call. So there's a call number where if anybody has questions or issues or whatever, they can call to this number and get support. And especially early on when we didn't have all the structure and everything in place, I had to take call overnight, and I would get questions from physicians on testing protocols and how to complete regulatory forms and whether a patient should be tested or not, just all kinds of things. So, just being flexible and stepping out to do those things. There were employee health related things. So if I traveled to anywhere, let's say New York, what are the ramifications of that? Do I need to quarantine? Do I have to get tested? And figuring out all of that with the legal aspects of it as well. And then, as Tarun mentioned, there was a ton of data and reporting that had to be compiled quickly. So things that we don't normally, talk about on a day-to-day basis, like how many ventilators we have available and how many are in use, or how many masks we have of various types. Those kind of things weren't things that we normally, report on a daily basis. So compiling all that and having that information available for decision-making on a daily basis was another thing. So it just, you never knew what was going to come up that day, and you had to be flexible and willing to do whatever it took to make things work.
With that, one of the learning experiences which we all, I think, are very well aware of, but when you're working in an emergency management type of a scenario, is easy to overlook is the needs of our customers. The value stream mapping always has taught us that you really design the processes from the standpoint of what our customer needs. But we all face the challenge of really balancing that with the operational needs and also protecting the safety of our customers. So a great example of this is as we had to really lock down our facilities to make sure we are not allowing visitors to avoid some of the unintended spread that might happen as a consequence of that. Most systems, as they are starting to open up, are now toiling with the question of what the visitation policy looks like. We all recognize that patient care is such a sensitive topic, and it means so much to people, and they need to be with their family. But the challenge of how do you really balance that with making sure your facilities are well positioned to be able to accommodate those visitors within the lobby and not lead to unintended consequences is something we continue to toil with. You're particularly challenged in the situation, again, when you start to realize and recognize that your visitors are making those decisions, but kind of customizing that to how it really is going to impact your facility, knowing how your facility is designed, is so very critical.
Another key learning, which kind of ties to the last one that I spoke to, is that emergency management requires agility. You might be familiar that FEMA has a set structure for emergency management and incident command, which is standardized so that in any incident, whether it be a train derailment, a car fire, everybody who's trained in this knows the structure and knows the various roles, so it makes it more efficient for response to an incident. However, with this being a really long-term incident, we had to scale and adapt that structure to fit with our situation, our organization, and our culture. And I'll give an example of this. We have a daily report out. It's every morning at 9 a.m. Where each of the incident command staff, as well as the chiefs, report out on what's going on. However, it's not just us that reports. We've actually kind of modified that reporting structure, and it's turned into more of like an operational huddle, addressing far more than just the COVID-19 related items. So, for example, we have a daily report on diversity and inclusion initiatives, which includes addressing the health disparities, and it's specifically focusing on health disparities associated with COVID-19 in our community. There's also importance in setting the structure and expectations early to avoid some of the chaos. When we first started up Incident Command, I was on the team for the first 3 weeks that it was launched. And I will tell you, it was incredibly stressful and chaotic as everyone tried to figure out their role and the structure. and people in the organization who were not trained in incident command were involved, and it all had to be just adapted to fit with the culture. And while there's really no way to avoid some of that chaos in an emergency event, communicating each person's role and the expectations at the beginning would have made for a much smoother sailing experience. And these roles are all defined in the FEMA structure, but need to be adapted, again, for each situation.
So kind of in lines with that, communication also becomes really critical. There are multiple levels of communication that need to happen in an emergency management situation. It required us to really track some of the decisions that were being taken at a state level. Some of the, at the same time, as Amanda pointed out, it required us to understand what we are experiencing operationally, and then effectively support that through the command center structure. So in order to really kind of, as Amanda mentioned, align the communication and make sure we are able to communicate with the right stakeholders at the right time, while we had the morning call to really give updates at a leadership level, we made sure that call also identified the priorities for the command center, and by applying agile frameworks, we were able to really come up with some quick plans that could then get approved by other channels by end of the day. We also adopted a lot of ongoing communication to the staff and the teammates within the organization twice a day via an email. That way they are very well aware of the priorities that are being worked on, and at the same time also are getting updated on the progress that's being made so they can go and access the right information at the right time.
And our final point on learning is assume positive intent. I used to work in an organization called Piedmont Healthcare, and at Piedmont we had these cultural norms that helped with alignment. And one of those norms was assume positive intent, which means that no one is going to say or propose something with the intent to harm others. So while an idea might sound outlandish or hurt my feelings, I need to remember to assume that the person has positive intent. And this is so important when we're throwing a group of folks together who might not know each other well and might not have ever worked together, and asking them to collaborate in an emergency event. It is so important to remember and assume positive intent from everyone. The next section that we're going to talk about is around opportunities that we've identified through this process. And by this, we're talking about opportunities that we can harness to move forward.
So harnessing technology is the first opportunity that we thought has really made a great headway through this whole COVID-19 process. I was at a presentation recently where they were talking about, could we even imagine how we would get through COVID-19 situation if we did not even have electronic medical records in place, and it was all managed via paper medical records like it used to be a few years back. So a few examples I would like to really give around how we have really identified the opportunity and embraced when it came to technology is when it came to patients, right? The chatbots, a lot of organizations, including us, we implemented a chatbot which really helps patients go and check on their symptoms to really self-identify whether they are a COVID symptomatic patient and need to do anything further about it. Something like this in the prior to COVID probably would have been a hard sell because organizations and patients were not ready for it. Virtual care, we have all heard about it. All of a sudden, providers and patients have all embraced it really well because there was no other option but to really adopt that technology to be able to stay in touch with their providers and get the care at the right time. And then the last one I would really highlight is work from home. The Microsoft Teams, the Skypes, they've existed forever and we've all known about it. There was some level of resistance both on the end of employers as well as employees because of the loss of personal relationships that they were scared of. But COVID-19 has proven, not just within our organization, but elsewhere through ad hoc data and some really concrete data, that these technologies have proven to make us more efficient in our work on a day-to-day basis.
The next opportunity is around connection, and this is really two kinds of connection. The first one is connection with other community resources. So we actually had to partner up with some of the nursing homes in the community to make sure that there was a thorough plan of care and it was coordinated with the hospital. Some of them wanted to test all of their residents or all the people staying at their nursing home, and that could result in an overload at the hospital, with patients. Some of them refused patients that are being discharged from the hospital unless they had been tested and we could prove that the patient was negative. So there was a lot of coordination with the nursing homes, and they often don't have all the same resources as a hospital in order to handle such a pandemic. So it was really important for us to coordinate with them. And another example is funeral homes. Fortunately, in our community, we did not get overwhelmed with deaths and have capacity issues in our morgue. However, we did reach out to all the funeral homes in our service area to assess what their capacity was and coordinate plans for timely transfer with dignity of all of our deceased patients. So the community connection was very important. And then I would say also personal connection is really important. I know we've probably all experienced some feelings of loneliness with the stay-at-home orders and with working from home. And it's really important to maintain connection with others, whether that be through regular calls or FaceTime, or my favorite has become the Zoom happy hours. I've actually gotten to spend more time with my friends, especially the ones that live far away as a result of COVID-19. Because we enjoy some scheduled Zoom meeting happy hours in the evenings. So that's been really fun, and staying connected, it really helps with mental health. And I think this is a huge opportunity to harness this enhanced communication going forward so that we can maintain these meaningful connections.
Related to productivity, I talked about some of the productivity gains we've had through individuals working from home, but another classic example that I have personally been intrigued by is, I know there have been presentations around the staff redeployment office. The staff redeployment office has really uniquely positioned us to challenge and stretch our work beyond what we are traditionally supposed to or have been trained to do. We had put together training programs for nurses that are trained but are in non-nursing roles so they could help with the search planning efforts. But also, I've been intrigued by how this has also challenged a lot of teammates to work beyond their regular work and almost has been a stretch assignment for them, which I think is going to position us better for the future.
The next one is around speed and innovation. And during this time, we've been forced to do things much more quickly than we normally do. And while we followed all of our normal approval channels, they weren't the normal channels of going to 29 different committees in order, with each committee only meeting once a month, so it takes you a year to get something approved. And this efficiency of getting things done faster but going through proper approvals has really presented an opportunity for us to review how we've gotten things done so expediently and really refine our bureaucracy and processes so that we can harness these new ways of doing business. So we're actually launching a Black Belt project to look at our governance processes so that we can try to take advantage of this opportunity that we've identified with getting things done faster. And the final one is the importance of supporting employees in time of change. So some of this might just look like reaching out and connecting even when it's not in person, inquiring about their support systems and needs. We're all challenged, if people have kids at home, or trying to work with their pets barking, or whatever challenges, there are new challenges, and that can be stressful for folks. So just reaching out and inquiring about those support systems, encouraging time away when it's needed. So it's very easy to get burned out. I think Tarun and I are really fortunate because we're friends outside of work, and so we can talk outside of work about things that are stressing us out and kind of be a support system for each other. But when you get too burned out, it's important to take that time away when it's needed. Making sure that our home work environment is conducive, especially for our staff members that might be working from home. Do they have a space with a door that doesn't have children or pets or distractions? Do they have a computer, a monitor? And I think the final one with this would be just genuinely caring about people and recognizing that we're all going through a tough time, and whether any of us verbalize it or not, everybody's struggling in some way. And just recognizing that and caring and reaching out and being genuine about it. Our third category is the look ahead. So what do we think the future is going to look like? And we've kind of put this into 3 different categories as well.
So analytics-driven decision-making, while this might sound really cliche, I have particularly been amazed with, personally speaking, all the limelight analytics got within the organization, right? Operational leaders, I feel, have a tendency to really operate based off their experience. But this pandemic brought a situation where there was a lot unknown, and they were really looking for some data to really drive where do they even go with some of the decisions they need to make on a day-to-day basis. That's not just within the organization, but I also feel like the government and the federal bodies have been really mindful of making sure they're tracking this on an ongoing basis. So as Amanda mentioned earlier on the call, there was tracking and monitoring that we did, not just on our COVID volumes, but on multiple fronts around how the employee population was or was not getting infected. How are we really tracking our testing, and what's the capacity around our testing looking like for our patients? What's the PPE inventory that we had to almost track and take a look at on an ongoing basis? In addition to that, I mentioned and talked about the search planning efforts that were heavily driven by some of the predictive analytics that we had to do to really understand what is the max capacity that we can plan and prepare for, and how do we really create protocols and procedures to be able to address that. And going forward, as we are doing the reentry planning as well, it has been absolutely critical for us to understand what's the lost volume of procedures we have had, how are we going to recover that, how are we going to really improve the capacity within our system to be able to accommodate more than what we have typically had in the past because of the patients waiting to get some of those procedures. And then even from an employee front, really understanding and analyzing what work from home would mean and doing some analytics around that, and what employee engagement is going to look like has all really been pivotal using data. So it's exciting to see how leadership has been now more open to embracing some of the analysis that's being done to make decisions on a day-to-day basis, and also some of the strategic decision making.
One of the areas that I've been particularly interested in since I work in facilities is what does the workplace environment look like? And there's kind of 2 workplaces now. We've got the remote workplace of people's homes as well as on-site. So with the remote workplace, I've already mentioned some of the challenges, making sure that they have a dedicated space, with a desk and the computer and all that to work from home. I particularly love my new remote coworker. Her name's Daisy, and she's my elderly dog that sleeps at my feet all day. And so looking at some of the satisfaction that comes from that. I have a window at my home office, which I don't have at work, so that's also really nice. Some other considerations are internet speed. So some of our employees live in rural areas and they don't have internet connection, or the speed is insufficient to be able to work from home. Similarly, the cell phone coverage, especially in remote areas or depending on the topography. And another thing to consider with remote work is that it's less stressful. I don't have a commute every day, so I actually use that time to walk my dog and work out. And I've been eating healthier too, because I've been eating at home when I work from home. So those are a few things with the remote work environment. With the on-site environment, I think we all probably can agree that that open office environment with a sea of workstations is probably not going to be what's going to be built in the future. We've been monitoring productivity based on people being physically present at an office, warming a chair, and that'll probably be a thing of the past as well. And then I've been trying to focus on shifting the mindset from, we used to think, is there any reason to conduct this business online or via phone? And often our reason would be that, somebody's at a remote location, another hospital or something. And so we had that attitude of do it in person unless there's some good reason to do it online. And shifting that attitude towards, is there any reason to do this in person? And even when I am physically at my office, if there is no reason to do something in person, I still sit inside my office and do it remotely, even if everybody else is still physically in the same building with me, for safety reasons. I think we'll also be seeing some modifications to facilities, things like touchless fixtures, in the bathrooms, like the water and the paper towels and those kind of things. And then, of course, some of the screening things that Charine mentioned with universal masking and temperature checks. I think we'll also see a shift where people used to, if I'm like, think I got a little cold or maybe some allergies, I might still go into the office. I think we're going to see a culture shift there where if I feel unwell in any way, just work from home just in case. And so I think that'll be a really positive shift that we'll see with the work environment. I think we'll also see a change in responsibility with our employees. Our environmental services cannot be the only ones that are going to be cleaning. It's going to end up being all of our jobs to clean throughout the day to keep the space safe. So that can involve things like cleaning our desk, door handles, light switches, our phones, keyboards, monitors, the buttons on the copier, the elevator buttons. All those things are going to need to be cleaned throughout the day, especially in office environments where environmental services might only normally come in once a day. Of course, we also will be responsible for wearing masks at work. I think most places have implemented the universal masking. So getting used to wearing the mask at work, having it be part of your regular laundering, with your cloth masks. Even the fashion ones, I've ordered a couple fashion ones to match my outfits. So I'm trying to have fun with it. And of course, increased washing of our hands, which is a great practice anyway. So I think this is very positive that this came from COVID-19. Many organizations have reported seeing decreases in hospital-acquired infections because of the increase in washing hands. So this is a really great thing for us to do anyway. And then use of break rooms and common areas in stages. So many office environments have a small break room, and 3 or 4 more people will take lunch at the same time and sit in a little break room and catch up. I think that culture is probably going to end up changing a little bit, where we try to do lunches and meal times in stages so that we can continue the social distancing.
So the next thing we're going to talk about is putting a stake in the ground. What were some of those learnings that we have had through COVID and some best practices that we have identified that we think will continue for the foreseeable future? I'm going to talk about the staff realignment and redeployment. The staff redeployment offices that were created as an ad hoc group to really realign staff has proven to be extremely successful. We are moving away from the culture where departmental leaders are protective of their staff and wanting to make sure that they're not getting reallocated to other jobs as a threat to their department. Instead, I think that has created this collaborative culture, which has 2 benefits in my mind. One is care team optimization. I remember when I worked at Mayo Clinic, which was my past employer, we would have continued ongoing projects on how do we really align the right roles to the right tasks. But this has really created that culture, as Amanda mentioned, where everybody might have to do cleaning, right? So I think it has really created that mindset that we need to do what's the most efficient for the organization and what makes more sense. The second important learning from this is career development. I think this is going to give us an opportunity. This is going to give managers and teammates an opportunity to really think about what's that stretch assignment that I can do along with my current job that's going to help me take that next step in my career. And I think that effort will become more successful instead of people really becoming protective of their own departments.
I'm really excited about the future of virtual care. Of course, most organizations had virtual care in place already, but COVID-19 really catapulted that forward very quickly. Of course, it aided in mitigating the community spread, but it also improved patient experience. For me, being new at Navicent, I had to change up my physicians, and one of my physicians is pulmonology. And I established a relationship with a new pulmonologist through virtual care. I'm sure it was probably uncomfortable for the pulmonologist because they can't listen to your chest and those sort of things. And I will go in for a physical appointment. But this was a great way to establish care. And I really loved the virtual environment. It reduced, of course, I didn't have to travel anywhere. I could do it from the privacy of my home, and it just felt a lot more personalized, and I felt like I had more time with the physician. So I think there's a big opportunity with making sure that we don't slide back and go back to the old ways of just doing things in person because we have a physical environment to do that. And we really have an opportunity to continue capitalizing on virtual care.
Just in alignment with that, it wasn't very long ago when we had to get to the airport a few hours before the flight so we could get our boarding pass. Look at the transformation that the industry has brought about in really printing off your boarding pass at home. Similarly, I think we are moving to an environment where customers are going to want and demand getting their appointment scheduled through an app instead of making that phone call and they dictating what the schedule looks like. Even in an inpatient environment, we were able to use technology like many other health systems very effectively to be able to allow for that patient and their family conversations because of the restricted visitation policy. I think we are going to start seeing a lot of technology usage in really helping satisfy our customer needs. And I think this pandemic has really forced us to accommodate our customer needs more effectively.
Another thing that'll probably change is the look of the private physician practice. We're already looking at decreasing real estate needs from people working from home. So if they're working from home, why do we need these big office buildings with a sea of workstations? I think the same will end up applying with the physician practices, not necessarily that there won't be physician practices, but their real estate needs may decline, especially as they increase virtual care, which they may choose to offer from their homes. Of course, the virtual care, like I mentioned, it expands the reach as travel distance is no longer an issue. They can offer expanded hours, but it will increase the technology needs of these physician practices. I think that the concept of destination services will change. So folks often would travel to these destination centers for care. So they might go to a cancer center or Mayo Clinic or Cleveland Clinic and so on. And I think that due to the travel risks, people might rely more heavily on care in their communities or closer to home rather than going to a destination facility that might require air travel.
Very much in alignment with that, as we are talking about the future of healthcare and the new era of healthcare, the population health management and the ACO efforts, I think, are going to significantly accelerate. With all the disparities that we are also that are coming to light through the pandemic recently, organizations and the healthcare system and community in general is going to start ensuring that they're providing that preventive care, and the patients are also going to become more educated and are going to proactively take care of some of the comorbidities, and we are not going to necessarily be in that situation where there's going to be as much, or hopefully not as much, of that tertiary care services necessary. For those of you who have an Apple Watch, your Apple Watch already kind of can give you indications when you you have an arrhythmia that's causing some heart challenges. So I can only see more and more of that technology coming about to be that is going to make the care delivery models significantly different from what they are today.
With that, I think that summarizes some of the learnings that we've had, the opportunities we've identified, and the look that we have for going forward. At this time, are there any questions or further discussion the group would like to have about any of the topics?
Yeah, thank you so much, Amanda and Tarun. I just want to mention, if you want to join in the conversation, please, you can type it in the chat. You can take yourself off mute and say it that way. Please jump in. We want this to be as open as possible. There is one question in the chat asking if we can elaborate more on predictive analytics, on what the future will hold. I think, Tarun, you were talking about that.
Yeah, absolutely. So I can maybe speak to that. It's a pretty broad question on what the future of predictive analytics might hold, but I often like to really categorize that into three buckets. One is the clinical analytics. You know, it's been fairly restricted so far, and I understand part of that is really driven by the lack of availability of data as openly, but there are a lot of predictive analytics models out there that are helping facilitate with some of the clinical decision making. And I can only see that's going to significantly broaden, and there'll be more consumer acceptance to that. The second one is related to operations analytics, and that has to do with, I was on a call just before I got on this think tank, and we have approached length of stay several ways in the past, and so very often we struggle with really sustaining some of those improvements because we are not looking at it as an entire system. So I can see how some of the predictive and prescriptive analytics can significantly be beneficial, like as you think of the simulation models that can really help drive making some significant changes within our hospital. And then the third bucket, of course, is more of that understanding and analysis and predictions around the hotspots within the community, so we are able to proactively provide some of that population health efforts, like Oak Street and health systems like that have made some significant headway in that space.
Awesome. All right, we've got some more questions coming in the chat. Next one, how will healthcare leaders create the tension to sustain the rapid innovation we've seen in the last 3 months? That can be directed at the speakers, or if anybody else has comments.
This is Amanda. I'll speak to one thing I'm battling. I think this is a challenge for all of us. I'm specifically working on something right now where we've seen a lot of productivity gains from folks working from home, specifically in our revenue cycle area, as well as some of our call centers. And I think that there is an eagerness to get back to normal, whatever that is. And so people are eager to call people back to like working in the office environment. And there's a lot to that, there's safety concerns, but there's also, we've had increases in productivity. Our employees are more engaged and happier. We might want to take a look at what we've done and not just go back to the old way. And so I'm trying to put together kind of a storyboard for that to support decision-making around keeping people at work from home and how much money we would save on facilities like leases and power and utilities, and looking at productivity and all the different aspects to try to facilitate decision-making around that now that we have the data from having done it. But it's certainly, this is certainly a challenge to keep that tension up and really sustain this.
Yeah, and I can speak to that a little bit from the work from home aspect. My company this was our first week where everybody was coming back in, and it was very interesting to see what people did. We're doing the fever checks, and we're asking those questions, a long list of questions on if you have a fever, et cetera, et cetera. But people here, I think, are turning this into a new normal, and I'm not sure where we should quite be there yet, but it's definitely interesting to see what we're going to take from this time period and move it forward. And I hope we do that. So, anybody else to the rapid innovation question?
Ali, I would also maybe add that, I think it's the external, our customers, our patients have learned a lot through this process too. And also the payers, I think they're going to force us to really sustain and enhance, if anything, our innovation.
This is Todd from Ohio Health. And so I would echo what I think Amanda brought up earlier. I think our organization is also looking at, we made a lot of decisions very quickly, and we did really good work in the last several months. And so it's time to start looking at, do we need consensus on every decision every time, or can we designate some folks, give them clear lines of what the input needs to be, but then who ultimately makes the decision. So I think that can also continue that rapid innovation.
Great. If we don't have any more questions related, I did come up with some discussion points just to continue this discussion further, and we're touching on that with these questions and during the presentation. I would also like to add, before we move into here, Amanda in the chat earlier, the positive intent, the assuming positive intent, I think really resonated. It came up in the chat a couple times, and I know myself personally, and not just when we're facing a pandemic, but to take on that positive intent attitude in all projects moving forward. I think that was a great point that you made. But so discussion points, and we kind of touched on this. Last week, we started talking about how are we feeling about the future as IEs, and along with that, how are we going to sustain this rapid innovation work? We have shown here through COVID-19 that we've taken projects that could have lasted 6 months, a year, and shortened it into 3 days a week. So how do we keep pushing this momentum that we have now for these rapid improvement events? Or what does the future, do we think, look like moving forward? I'm just going to open that up for discussion. So yeah, jump in.
This is Amanda. I'll say that how I feel about the future is hopeful. I know that we've had a lot of stress with COVID-19 and a lot of change really rapidly. And to me, change equals progress because at least we're trying something new. And if it didn't work, we're learning from that and can keep tweaking. So I see a lot of really positive things that have come from COVID-19. Not to discount the horrible negative things that people have been ill and many people have died. However, I'm trying to focus more on the positive and how do we identify those positive things and keep those going and promulgate that forward. So I would say I feel very hopeful about the future.
It looks like there is another question in the chat. What tools and platforms are we considering while trying to collaborate with others other than WebEx, specifically while working remotely as an IE?
So some of the things that we're using are, we're using Skype, of course, both the chat function as well as meeting and, video conferencing through Skype as well as Microsoft Teams. We've been using Zoom calls as well, which are, I think all three of those are fairly similar. FaceTime, and I've learned that you can do FaceTime with small groups as well. And then obviously the typical stuff of phone calls and texting are some of the tools I've been using.
Yeah, and I think it was a few think tanks back where there's actually a function within WebEx or Zoom that you can section off and do individual group huddles. So whereas if you were normally in a large room and you were sectioning off into 3 to 4 groups to discuss things, they allow that in WebEx and I think in Teams as well. So I know that's something we use as I use a lot to go off, brainstorm, come back. So I think that's a really cool function that I didn't know existed before these think tanks. Great.
Thank you. I was just wondering if you guys had like, that was actually one main question, was if you could break into groups, other than WebEx, if you could break into groups with using Teams or any other platforms, but that's a very important thing that I think will be a key factor moving forward. So thank you.
Yeah, I'll go back and look. I'm pretty sure it was WebEx where they had this separate discussion rooms, but I'll go check. Anyone else on the discussion points of what's next or any tools that you guys have been using?
No, this is Josh. I think where I'm just more hopeful on moving forward is over the last, few months, we've seen more work done in more of this rapid improvement type methodology versus leading through multiple committees and things just taking forever to get done before you can ask for help. So I'm really hopeful in the fact that this is more of a catalyst to help get work more towards on the front lines and have more of us helping support some of that work and really the problem solvers on the front lines doing the work moving forward versus a committee making a decision somewhere every month or two.
Great. Well, with that, I am going to close out. Thank you so much again, Amanda and Tarun. I think this is incredibly beneficial and a great last think tank to end things on. We are in talks of what are we going to do next, which is kind of why we talked about these discussion points of what is next after this from a think tank perspective, from a continuing to collaborate. We don't want to lose that momentum, but we're looking at how we can transform this into something new. So be on the lookout for that. And thank you all again.
Thank you. Thanks for hosting us, Allie.
Thank
Yeah,
you,
no
guys.
problem.
Take care. Bye.
Thank you.
Thanks, guys.
Thank you.
Yeah.